Welcome to Ritter Cares. I'm Michael McConnell, and I'm a reference associate here at the Ritter Public Library. In this installment of the Ritter Cares series, we will be speaking with James Wilson. He is a dietitian at Kingston in Vermilion. Kingston operates senior living and rehabilitation services in several states throughout the country. Here in Vermilion, there are 2 Kingston facilities providing senior living and rehab services. Today, we'll be discussing nutrition. Eating well is important at every stage of life, but as we get older, our metabolism slows down and our body requires different nutrients. Therefore, it is essential to maintain a healthy diet. With the difficulty of finding valid nutrition information, along with the prevalence of food deserts in both Erie and Lorain counties, we thought this was an important issue to address for our patrons. So James, do you want to tell us a little bit about yourself, and then we can start talking about nutrition?
Yeah. So thank you, Michael. I appreciate everything that Ritter Public Library does for the community. I know I certainly miss taking my daughter there all the time with all this everything going on. But so I appreciate being a part of your efforts for the community. When it comes to nutrition, I mean, you kind of said it yourself how important it is. When I went to school, I didn't really know what I wanted to do, but nutrition there was kind of a program that opened for me to be a part of, and I always felt that nutrition was a topic that is very much misunderstood, and it can seem very complicated. So I kind of made it my effort to understand it the best that I can, and be able to relay that information onto whether it's patients, residents, the community, in an effort to make our community better.
All right, great. Well, so on that note, are there any specifics you can tell us about nutrition and what seniors can do to lead a healthier lifestyle?
When it comes to seniors specifically, specific nutrients that I would really try to focus on throughout the winter time would definitely be vitamin D, because we're not outside as much. And vitamin D actually plays a pretty critical role in your immune system. So it's important to get enough vitamin D. You can find a lot of different foods that are fortified with it. So it's not always a matter of, do I need to take a vitamin D supplement? When it comes to just overall health, I think with seniors with decreased activity, there becomes more of an emphasis on eating healthy, because you don't always have that activity to balance out the poor food choices sometimes that happen in our culture, which I'm not immune to them. I know I have my own struggles with eating. I'm definitely not perfect, but I feel like I have a good understanding of how to improve myself and help others improve themselves.
All right. Obviously, you mentioned vitamin D. Is there any other nutrients specifically that seniors should prioritize?
I mean, you hear people highlight a lot of other micronutrients, but they all play an intricate part in how your body functions. So when it comes to your immune system, for example, I mean, most micronutrients play a part in some way, whether direct or indirect in your immune system. So I mean, when all this started, you probably heard about the vitamin supplements flying off the shelves at grocery stores. And while that's okay, I mean, I take a multivitamin myself, but I've always been one to kind of teach that you need to focus on your food, because I think sometimes our culture will lean on those supplements to kind of just say, well, I'm not going to make my food choices as
Yeah.
much of a priority because I have this pill that I can take. So when it comes to highlighting other nutrients, I mean, vitamin A, vitamin E, those antioxidants, those are all really, really important. But they're all important. So when
Yeah.
it comes to getting those micronutrients, most of the time it's you want to eat more fruits and vegetables. And most people, they know that. They know that they should eat more fruits and vegetables. So it's a matter of how do we actually go about doing that? Because a lot of times we live in a fast-paced culture, and we kind of let our environments make the food choices for us rather than actually taking the time to think about what we're actually eating.
Yeah. Okay. So essentially what you're saying is it's more important to have a balanced, healthy diet with what you're eating. Whereas, I mean, taking pills, taking vitamins can certainly help, but it's more important to have a balanced diet.
Absolutely.
Yeah. Well, speaking of actual diets, obviously there are a lot of diet fads out there. Are there any that are credible, or is it just boiled down to, again, having a balanced diet?
So I get this question a lot.
Mm-hmm.
I mean, I've been a dietitian for about 7 years.
Mm-hmm.
And so when it comes to fad diets, um, people put labels on certain diets that are kind of put out there, whether it's by health professionals or whether it's from just kind of fitness trends. And there's a lot of misunderstanding because we define the word diet differently.
Yeah.
I mean, when I say the word diet, I just mean the foods that you normally eat. It's not necessarily I have a planned out, I'm going on this diet and this is how long I'm going to follow it. Um, to better answer your question, to highlight a few diets that are you hear a lot about recently, the ketogenic diet, which to actually follow a ketogenic diet, you have to consume less than 50 grams of carbohydrates throughout the entire day. And most of the people that I talk to that have followed it actually don't have a very good understanding of even how to count carbohydrates.
Yeah.
So a lot of people think that they're following a ketogenic diet, but they're not even really doing that. So when it comes to those fad diets, which the ketogenic diet has been used for other purposes, you could label it a fad diet, but it's been used for other purposes. Like it's been used for people with epilepsy for a long time. So there are certain benefits to diets. There's pros and cons to most diets, I guess I should say. And my philosophy has always been that if you can't maintain the changes that you're making long term, then it's ultimately not going to be beneficial to you long term.
Yeah.
So it's a matter of the person. I think more research needs to be done about the ketogenic diet. For me to actually say you should follow this as a healthcare professional. But there are people out there that get good results from those kinds of diets. Other diets that you see a lot of people on are like Weight Watchers, which is, I mean, the point system kind of thing. Most diets, it's a matter of how it changes what food choices you're making. And that's the bottom line. You can be on a diet, but if you're not following it well, the diet's not benefiting you.
Yeah.
So,
and there's also the issue, a lot of people will follow the diet for a couple weeks or a month, and then they go right back to their old habits. And
Right, right. Which that's a problem for a lot of people. I mean, we don't consistently make good choices all the time.
Mm-hmm.
Um, I mean, I know it's about keeping yourself accountable.
Mm-hmm.
Like I can identify plenty of times in my life when I was a practicing dietitian and I had
Mm-hmm.
to stop and say to myself, okay, we're starting to trend in the wrong direction. We need to go back the other way because because I need to be practicing what I'm telling people to do.
Mm-hmm. All right. So are there any specific health concerns um, that eating well can either reverse or prevent?
Um, Reverse, prevent. I I thought about this. When it comes to like reversing conditions,
Mm-hmm.
like diabetes, for example.
Yeah.
I Through my time as a dietitian, I've helped a lot of people improve their diabetes,
Mm-hmm.
even get off of medication through
Mm-hmm.
diet changes. Whether you want to call it reversing it or just prevention,
Yeah.
that's kind of, people have different opinions on that.
Mm-hmm.
But your diet choices very much have a role in many chronic illnesses. I mean, most of the top 10 causes of death in the United States have some, nutrition has some sort of impact in,
Mm-hmm.
whether it's cardiovascular disease or diabetes. Um, but it's a matter of how those chronic diseases are managed in the long term,
Mm-hmm.
um, that really plays the most impact. And I
Mm-hmm.
think that's what it boils down to is a lot of people want to focus on the short term. What can I eat now that satisfies me today rather
Mm-hmm.
than focusing on how do I create goals to work towards a healthier lifestyle long term.
Mm-hmm. So you mentioned diabetes, and obviously sugar is a major concern. Are there ways that, our patrons and seniors in general can reduce their sugar intake?
Um, Reducing sugar intake, the best thing honestly to do, looking at food labels, you see food labels now, they have
Mm-hmm.
added sugars listed. Um, it used to just be sugars and carbohydrates, but now you have the carbohydrates, the sugars, and the added sugars.
Mm-hmm.
You really want to reduce those added sugars to less than 10% of your calories per day.
Okay.
Now, I'll preface that with saying I don't think I've ever met anybody who tallied up every gram of sugar that they
Mm-hmm.
ate throughout the whole day and made sure it was less than 10% of their total calories.
Mm-hmm.
Um, Not a lot of people do that. So, general recommendations for reducing sugar, I would say focus on what is in your fluids, what you are drinking.
Mm-hmm.
Um, because most of the time, what we're eating is okay, and then we slap a high sugar beverage on there,
Mm-hmm.
whether it's pop, whether it's fruit juice, whether it's a lot of different high sugar beverages, what's in your coffee, um, and it really adds up on
Yeah.
you, and you don't even know it because it goes down so fast.
Mm-hmm.
Um, so what you are drinking, also obviously reducing sweets. Um, that's especially important as we go into the holidays.
Mm-hmm.
But you also, but I also believe that all food should be enjoyed.
Mm-hmm.
So I particularly enjoy having ice cream every once in a while.
Mm-hmm.
Um, but I don't, the way that I kind of mediate my extra sugar from the ice cream is that I don't purchase ice cream. I don't keep it in my house.
Mm-hmm.
Um, I If you create an environment where you're making good food choices, that can limit your added sugars. When you're at the grocery store, You can look at food labels, try to buy more fresh and frozen fruits than canned. A lot of those canned products have added sugars in them. So that's just a few points.
Okay. Now, another issue, you mentioned holidays coming up. So an issue a lot of people have is overeating. Are there any ways that our patrons can, be aware that they're overeating, ways to prevent it?
Yeah. Yeah, that's a simple yet complicated question for a lot of people. Because I think it comes down to the why. Why are people overeating? And there's a lot of different reasons for that. We don't just eat to get micronutrients. That's not my main motivation when I sit down for lunch. So people eat out of stress. They eat out of boredom. I think we've seen that with a lot of people during this time where people are at home more. If people are bored, eating is one of those things we use to fill our time. So I think recognizing why you're actually going to reach for that snack between meals, or why you're going to the fridge right before bed, is the kind of leads to what you can do to change the overeating.
Okay.
You have to know your certain tendencies with food. Like for my example with the ice cream, like I know my tendencies with ice cream, and that's why I don't purchase it. Because I don't want to go to bed at night and then have the ice cream calling me from the fridge, So I think that is definitely one way. When it comes to the holidays, I've always been one to tell people to, rather than try and be incredibly strict with yourself on the holidays, try to just make it a one trip kind of thing. Like you have your plate and you make one round, and what fits on your plate is what you have.
Don't go back for seconds and thirds.
Right.
Yeah.
I think that's what gets people a lot, is the tendency to the food sitting out, and then I just keep going back for a little bit more. So trying to keep yourself in check in that way, I think, is the best thing that you can do while still enjoying your meal. Because like I said, I firmly believe that all food is meant to be enjoyed. It's just some are meant to be enjoyed more than others.
Yeah. All right. So another issue some of our senior patrons may have is, that we kind of touched on earlier, is that nutrition fads cycle out. Is there anything specifically that, 25 to 50 years ago may have been suggested that is completely wrong now or different now?
Depends on who you talk to. Depends on who was giving the information. In general, when it comes to like for example, like the U.S. dietary guidelines, those started in 1980. If you look on their website, you can see the U.S. dietary guidelines every 5 years that they were put out. And you really don't see a lot of change from the food groups themselves. It's more been a change of how the information is portrayed to the public. Like, for example, in the most recent U.S. dietary guidelines, you don't see a value for total cholesterol mentioned. So prior to that, the U.S. dietary guidelines had mentioned that you should try to keep your cholesterol less than 300 milligrams per day. But you don't see that now.
Okay.
And so a lot of people have taken that information and made it out to be, it doesn't matter at all how much cholesterol I eat. But it, like I said, it's more of a change in how information is portrayed. Most foods that are high in cholesterol have other things in them that you want to avoid. So for me, I don't think it really changes my food recommendations to people that much. But that's kind of the biggest change you see throughout the years in terms of the guidelines. And in terms of short-term diets, I mean, there will always be new variations of kind of the same thing. See diets that extremely restrict fat or diets that extremely restrict carbohydrates, when it's really about the individual learning how to balance it all, rather than trying to just get rid of one thing in hopes that that ultimately helps improve their life.
All right, great. Well, you've given us a lot of good information. Are there any other resources that our patrons can look to for nutrition information?
So I would definitely go to the USDA website, myplate.gov. There's a lot of good information on there. The organization that I get my registration through to be a dietitian, they have a great website. It's called eatright.org. And when it comes to seniors, there's a lot of good information on like the American Heart Association's website, heart.org. But if you'd like more information, or you would like a concrete set of links that you would like to put out to the public that I could get for you, I'd love to be able to do that to help you serve the community.
All right, great. Well, yeah, we'll add those then to our video then. You know, thanks for all this great information. It's definitely going to help our patrons. And thanks for your time.
All right. Thank you, Michael. I appreciate it.